Hello, this is Angela Shime presenting from UOIT. I am with Aaron Fahim, an epidemiologist at UOIT. Today we are going to talk about the Ebola outbreak in the west part of Africa, which started in March 2014 and continues to the present day. We are all aware of the ongoing outbreak of Ebola in West Africa. Have there been any Ebola outbreaks like this in the past? Can you tell us a little bit about the history of Ebola?
Ebola has appeared in many countries such as USA, Philippines, Russia, and Europe, but most of the outbreaks have occurred in African countries. The first outbreak of Ebola was in Sudan in June of 1976. The second outbreak was in August of 1976 in the Congo, in an area near the Ebola River. This outbreak was the first recognition of the disease, and where it took on the name Ebola. A third outbreak was in the same region between July and October of 1977. The current outbreak is the largest to date.
Can you tell us what Ebola is? Also, what signs and symptoms does Ebola manifest?
Ebola is a viral infection caused by a negative strand of RNA virus known as an Ebovirus. In the early stage, it is characterized by a hemorrhagic fever, severe headache, joint and muscle ache, chills, and weakness. As the disease progresses, patients may develop nausea and vomiting, diarrhea, red eyes, raised rush, chest pain and cough, stomach pain, severe weight loss, bleeding, which is usually internal or from the eyes and orifices, and bruising.
Thank you for that information, Aaron. Now, can you tell us where Ebola comes from? How is it transmitted and who is most susceptible?
Experts suspect that Ebola is transmitted to humans through body fluids of animals such as monkeys. Ebola is not airborne, but it can be transferred by direct or indirect contact. For example, through the blood or waste product of sick animal who is either eaten or cared for. Once an infected person starts to develop symptoms, he or she is infectious carrier. The disease can spread from person to person via bodily fluids. Those who care for Ebola patients and those who perform the burial practices, such as washing dead bodies, are the most susceptible.
Are there any treatments or vaccines for Ebola? Are they effective?
There is currently no cure or vaccine for Ebola. We can, however, take precautions to prevent transmission, such as wearing PPE, disinfecting foamets, practicing regular hand washing, and quarantining individuals who are known to have been in contact with Ebola. Some clinical treatments include providing intravenous fluids and balancing electrolytes, maintaining oxygen status and blood pressure, treating other infections if they occur. There are some experimental vaccines for Ebola under development. However, they are not tested yet to show any effectiveness.
One final question, Aaron. What should we do if we get infected or if we come in contact with an Ebola infected person?
If you come in contact with someone who is infected, inform your medical professionals immediately. Check your temperature and be aware of signs and symptoms, and be cooperative with healthcare professionals.
Thank you, Aaron, for your very educating information.